Snoring. It can certainly annoy the person on the other side of the bed.
And it can also be the sign of a more serious problem. Just one of the things you can learn more about at Men's Health Night happening tomorrow night.
It is, and Dr. Christopher Dybert is here to tell us who should go to this thing. Good to see you, Doctor.
Hi, good morning.
Doctor, you are the co-director of the Men's Health Program at Nebraska Medicine. What does this program do? What's this program geared toward?
That's right. So the Men's Health Program is one of many new programs that we're developing at Nebraska Medicine. We've been live for a few months now, and the goal of the program is twofold. One, we want to serve men that otherwise haven't been to a doctor in years, maybe don't have a primary care doctor, and just want to be seen in established care. Secondly, we want to serve the needs of men in the greater Omaha community who have concerns about their sexual dysfunction, their energy levels, sleep concerns, really anything that's geared towards male-specific medical questions.
Well, and a lot of those things that we hear about as men age, of course. So this Men's Health Night that's coming up tomorrow, what's planned? How do we get the guys to go?
Well, it's that nudge you were talking about, right?
Exactly.
Yep, so the nudge. Tomorrow night at Village Pointe at 6 p.m., I and one of my colleagues, Dr. Summers, who's a sleep medicine specialist, will be talking with men and their spouses, their partners, anyone who would like to come, about sleep issues, sleep quality issues, testosterone therapy, erectile and other sexual dysfunction issues, and just general men's health topics. So there'll be a program in which we actually present some of those topics, and then a lot of time for just question and answers so that we can answer the needs of men that are able to join tomorrow night.
Well, let's focus on a couple of those issues. Let's start with, well, we talked about snoring off the top, right? I mean, I've got a friend whose wife has recorded him snoring.
That could be me too, actually, because I've done the same thing.
And but how can, because sometimes this correlates to sleep apnea.
Right.
How often does snoring mean that there's some sort of sleep apnea issue, and how many times is just a bad position in bed that is causing the snoring?
Sure. So almost all, or not all snoring is sleep apnea, right? Yeah. Apnea means that you actually stop breathing in between those big snores. So that's what we want to try and figure out with men. And the reason that's important is because sleep apnea can be a sign of other underlying disease, and sleep apnea can also cause worsening heart disease, worse heart failure, more issues with high blood pressure. So identifying men who have that and helping them sleep better, breathe better, that can increase their energy level during the day, and it can help decrease any other medical problems that might be going on. So Dr. Summers is actually our main sleep specialist, and he'll be talking about that a lot tomorrow night at our program.
How common is sleep apnea?
Sleep apnea, I believe, occurs for about 10 to 15% of the male population. A lot more men snore than that, so again, not all snoring is apnea, but we do screen for that in our men's health clinic visits and consults. All
right, let's switch gears a little bit, talk about something that people don't always talk about.
But we'll talk about it here.
We will on this show. The romance. Some guys maybe feel they don't have that desire anymore, right? So how are you going to address that topic tomorrow night?
Sure. So tomorrow night we're going to talk about libido, right? That's sexual desire, sexual drive. We're going to talk about erectile and sexual dysfunction and how all of those interact. A decrease in libido or a change in your sex drive and in the element of romance there, that might be a sign of erectile dysfunction. It might be a sign of a testosterone or hormonal deficiency. And one of the big things that I do, that I have some specialized training in, is really trying to identify the underlying medical issues that might be related to that lower libido, things like testosterone deficiency, and then try and improve those.
Well, and that has become such a big topic recently. I mean, a couple of years ago, if you said low T, nobody would know what it means.
They'd think it was a rapper or
Yeah,
something.
low T, everybody knows what it is. How common is testosterone deficiency in men?
Sure, so our airwaves are inundated with that right now.
all the time.
So it's probably on the order of 5 to 10% of men have a true testosterone deficiency. And what that means is they have those non-specific symptoms of lowered sex drive, low energy, easy fatigue. But those can be a lot of different medical issues, not just testosterone related. So the main goal of our men's health clinic is to talk to men about these symptoms, but then really try and identify the underlying medical problems that might be causing them. Because depression, sleep apnea, low testosterone, other sort of heart conditions, all of those issues could cause these symptoms that men often equate just with low testosterone. So it's not a one-size-fits-all strategy.
I was going to say, it sounds a little more complicated than just, do I have low testosterone? There could be other factors.
And we screen for that, we do the right tests for that, but if it's not it, we want to identify those underlying causes and really address that for the overall optimization of health.
Sure.
Well, if you're a guy out there watching this, or even more likely, if you're a woman
Probably
out there
the women.
watching this,
Probably the women telling the guys.
and you're thinking some of this stuff might correlate to some of what you've seen with your spouse, what things specifically would you say symptomatically should they come see you for?
Sure. So the main things that I see men for in the men's health clinic at Nebraska Medicine are concerns about their sexual function, concerns about their overall energy level and fatigue level, and then sometimes concerns about their sleep and other health concerns as well. It's not just me in the program. Dr. Summers is our pulmonary specialist who works there. Dr. Joel Armitage and Anna McGrain are part of our urology and primary care team as well. So again, we want to provide full service care to these men.
Yeah, well, Men's Health Night is free, but really you should pre-register. Don't you recommend that, doctor? People go ahead and pre-register for this?
We do.
Yeah. 559-4292. Tomorrow night at 6 o'clock, right there in Village Pointe at Nebraska Medicine. Just give them a call. NebraskaMed.com is the website.
Ladies, tell your husband, hey, we're going out to dinner, and then you just swing on by.
No, don't do that. Don't do that.
There will be some hors d'oeuvres and snacks there, so there will be
Right.
some food, but not a full meal.
Thanks,
we look
Doc.
forward to talking to all those men tomorrow night.
Yeah, thanks, doctor. Good to see you.
Good to see you guys
Appreciate
too.
it.
I guess in the morning.